I'm Bethany. I'm a student nurse, close recruit for privacy. Can you tell me your name and date of birth, please? Alrighty, okay. Well, the doctor has orders for you to have a nasogastric tube inserted, where we're going to insert that on one side of your nose. It's going to go down the back of your throat, and then it's going to reach your stomach. That's going to allow us to check your pH level of your stomach to see how acidic it is and to know how full it is, and we can directly administer food and medications. Do you have any questions of what we'll be doing? And is it okay if I do this with you? Alrighty, so before I begin, I'm gonna do a assessment with you, which I'm gonna listen to your bowel sounds and remove your covers here for a little bit. I'm gonna listen into each quadrant. There's 4 spots, and listen for 1 full minute. If there's no bowel sounds for that 1 full minute, I'll listen for 5 minutes. And your bowels are active, which is good. All right, we can set that to the side actually. Alrighty, so also we're gonna measure, I'm gonna measure your vitals and also have the oxygen saturation on throughout the procedure just to see how it's doing and know that your oxygen levels are where they need to be in the good range of 95 to 100%. I'm going to give you a tissue here. Let me have you cough, and with my pen light and I'm gonna check for your gag reflex, and that's intact. All right, and we're gonna check for patency of your nose, which is, we're gonna just see how clear and open your nasal airway is. So let me have you take 2 fingers, press against your nose, breathe in and out, and your other side, breathe in and out. Okay, it looks like your left one is most clear. Alrighty, and just to review with you, in your chart, you haven't had any basilar skull fractures, you haven't had any nosebleeds, you haven't had any, or you're not taking any anticoagulation therapy, and also looking, and as I observed on your nasal passage, you don't have any polyps or deviated septum. Alrighty, okay. So now that we've got that taken, the assessment first, we're going to put you in a high Fowler's position. Alrighty, let me get my hands washed here and my supplies out. Get that cup filled with water. There. All right, we're gonna place this in case there's anything that leaks down while we're getting that NG tube inserted, okay? Alrighty. And all my supplies is in with expiration, and they're not tampered with, no tears, no breaks, and no signs of it being soiled. Open away from me. could have sworn that I had my lubrication. Okay. Okay, I'm gonna hand hygiene and put on some gloves. Alrighty, so I have my indelible marker, which I'll just get on your gloves and hand hygiene. And have my marker cleaned. Okay, we're going to measure from the tip of the nose to the earlobe, down to the xiphoid process, and add 15.2 centimeters. So that's 51, and we'll get it to 66 inches. Alrighty. We're going to prime. And just if I didn't ask at the beginning, you haven't had any recent nosebleeds? Okay. Got 10 milliliters here. Okay, so you have a tissue with you, you have your water. When we first start this, you're going to put your head towards the ceiling and look up for me. And then when I get down to the back of your throat, you're going to put your head to your chest, okay? Alrighty, make sure I don't, there we go. Alrighty, and then I need you to breathe through your mouth and sip on your water when we get to that point, but make sure to breathe through your mouth, okay? On the count of 3, and before I begin, I did mark it with my indelible marker at 66 inches, okay? All right, here we go with the count of 3. 1, 2, 3. All right. Okay, now you're gonna put your head to your chest and start sipping on your water, okay? All right, I'm gonna measure and see if there's any, I'm gonna hold and see if there's any air coming out. There's no air, so I can continue to my marker. Almost there. Alrighty, okay. Now we'll hold it right there. I'm gonna tape it and get it secured to your nose. How are you feeling? And I also could have told my patient if they had any discomfort to raise their hand throughout the procedure. They needed to stop, and if it was too uncomfortable. Okay. Okay, I'm gonna get it to your cheek and then I'm gonna look for placement in your mouth, okay? All right, and then we'll also get it taped here on your gown. Okay. We'll keep that there just for a moment as well. I'm gonna take a pen light here and note that it's in good placement, okay? Alrighty, how are you feeling? Okay, let me clean up your nose here. We're gonna go get a abdominal x-ray for you to make sure we have it in right placement. So you've come back from that x-ray and I'm gonna put on new gloves here. Alright, so I can take that out of the way. So we're gonna now test for your pH content and also provide oral care. And now with the pH, we're going to make sure there's no air or no water. We're gonna pull back 10 milliliters of air because that's what we're gonna instill. Okay, push that air in. We'll not lock it yet, and we're gonna take out 10. Now we're gonna clamp it and push that in. And this is clamped, okay. Alrighty, so depending on fasting, if fasting for 4 hours, it will be less than 5. And if the patient has been on a continuous feeding, which they're not, it'd be more than 5. But with the pH, it measures at 5 at the moment with gastric fluid content. Alrighty. So before I leave, we're also going to get the suction started and hooked up here. So I'm going to take off these gloves and hand sanitize. Okay, looking at my expiration, noticing that the supply is in good expiration and it's not been tampered with. Alright, and I've reviewed the provider's orders and we're gonna get the suction on a regular suction at 100 milliliters per mercury. I'm gonna set this here just for a moment. I'm gonna get gloves. Sorry. I'm gonna get gloves, hand hygiene. Alright, but I'm not gonna put suction on right away. I'm gonna hook up the suction and then we'll turn it on. So with this first. Alright, and it is open. Okay, we can remove this. And we're gonna put it on the level that it was ordered of 100. Well, we're gonna turn it on. Sorry, and then put the dial on to 100. Okay, so I'll finish up cleaning up my supplies. I'll hand hygiene, make sure the patient is in a comfortable position. And would you like to lay back down? And the bed is lowest to the ground. All right, so now for documentation, I'm going to document the vital signs and note that the SpO2, the oxygen saturation, was in good levels throughout their vital signs. We're going to document the insertion length in centimeters, which was 66 centimeters. I'm going to document how the patient tolerated the procedure, that we did have a abdominal x-ray to confirm placement. I'm going to document the pH of the gastric content and how well the patient tolerated the procedure. Okay, so that was my my insertion. So now I'm coming back in the room. Hello, I'm Bethany. I'm a student nurse. Can you verify your name and date of birth, please? Alrighty, so it's been several days in the doctor since you've had your nasogastric tube inserted, and the provider has asked me to remove it. So it should be fairly quick and non-painful. Do you have any questions of what we'll be doing? Is it okay if I do that with you? Alrighty, well let me perform some hand hygiene here and get some gloves on. We'll get a new Blue Chucks pad on ya in case there is anything that comes out. Okay. There. Alright, so I'm looking at the volume of the suction. I'm noticing the color and consistency. If there's blood or black solution, fluid, that I'm going to notify the provider of that. Before I remove, I'm going to stop the suction and turn it down. I'm going to turn it off. I'm going to notice the patient's nostrils and the skin for any skin breakdown, which it looks like it's good, and the length of insertion is where it is of when it was inserted. So we're going to unhook here. Okay, good. Remove it from your gown. Remove it from your face here. I have a tissue provided. When I take this out, you're gonna hold your breath in, take a deep breath in and hold it, okay? All right, and we'll do that here and just as I get this tapes taken off. Sorry for that. All right, on the count of 3, hold your breath, take a deep breath in and hold it, okay? 1, 2, 3. All right, and tissues, okay? I'm noticing that the nasogastric tube is in contact, and I'll make sure to document that, and this will be disposed of. I'm also going to dispose of the suctioning or keep it for the provider to see the content and the volume or the color. If it was black or red for blood. Perform hand hygiene. I'm going to clean up the nostril, provide or have the patient complete oral care. Okay. And I think the big thing that I missed here is that I would have the patient in a high Fowler's position to avoid aspiration. So they, instead of a semi, they should have been in a full high Fowler's position. That was one thing that I should have noticed before removal. My supplies is cleaned up. The patient has everything needed and call light in hand. I'm going to document the volume of the gastric contents. I'm going to document how well the patient tolerated the removal of the nasogastric tube. I'm going to document where the length was when I did remove it, and I believe that's it for discontinuing. So I believe I got everything, but my patient should have been in a very high Fowler's position for removal.